All right, so let's start here with what is a diastasis. A lot of women know what diastasis is. I'm not sure about men. The reason why I took my pre and postnatal certification was specifically for dealing with women with diastasis, and men, I guess. It's not touched on a lot in the course that I learned. There's a little bit in there, but it's not something that's talked about or seen as much. And I actually have a client that I've just discovered who is a male that has a diastasis. So that's kind of what's triggered me to make these videos with little bits of information kind of throughout the day. So what is a diastasis? A diastasis is basically ab separation of the linea alba more than 2 centimeters. When they pull apart, kind of everything inside can kind of poke through, and there's not as much tension in here through the core. So what causes a diastasis? Obviously in women, the most common cause of a diastasis is pregnancy, because everything's stretching and growing and moving and nothing is normal in there when you're pregnant. But for men, and I guess for women as well, a diastasis can be seen with obesity, excessive long-term bloating, overdeveloped external core muscles, so just like your abdominis recti and your obliques, mixed with weaker or neglected internal abdominal muscles, so your transverse abdominis down here inside, which is what I do work a lot with my postpartum women, or habitual outward pressure on your core can make the connective tissue of the abdominal wall stretch. And that habitual outward pressure is usually caused by improper weightlifting, not breathing properly, sit-ups, crunches, or planks. Again, these exercises can all be done just with proper breathing and proper engagement, which sometimes needs to be learned because, again, habitual, we get into habits of doing things improperly. Now with a lot of women, sit-ups and crunches are out the window once you've had a baby. I don't recommend them because along with diastasis, there's other issues that can arise, which a lot of trainers don't actually know, and will have postpartum women doing full sit-ups or crunches and stuff. All right, so what are the symptoms of diastasis recti? Now, these symptoms can go for men and women. Obviously, some of them that you hear will be exclusive to men, but it can cause lower back and hip pain, poor posture, painful sex for both men and women, erectile dysfunction, a visible pooch or bulge just below or above the belly button, which is unfortunately deemed mommy tummy, which I don't agree with, but I'm sure some people can relate. And then you can also struggle with urine leaking and constipation. This can also go for men as well. If you don't have those tight pelvic floor muscles. Yes, you guys have pelvic floor muscles as well. Yeah, those are some definite things you can see. I will go into the next video to describe a more physical symptom to see while you're working out or using your core. And lastly, one way you can tell, this is actually how my male client discovered that he might be suffering from a diastasis. He brought to my attention that when he was doing sit-ups or certain things, he had like almost like a coning or a bulge, and that's a very telltale symptom. I can't show you because I'm currently I'm good. I don't have a diastasis, but everything almost kind of like cones outwards, like almost like a football in the midline of your stomach. You might even notice it when you cough. So it's definitely some information to be aware of, acknowledge. Any trainers out there, if you're not certified, maybe do some research on diastasis so you know how to help your clients, and vice versa. If you know you have one, you can let your trainers know, or work with a trainer specialized like myself.